Hello and welcome to this brief video on apps in family medicine from RCSI Perdana Family Medicine Department. I'm Professor Anthony Cummins. These are the apps and online sources we're going to look at. They're not all apps. Some are web resources like Cochrane Pearls and evidence updates, etc. Some are Twitter feeds. Some are interactive textbooks, but some are particularly useful apps like Pubmed for Handheld, Quick Medicine, Camscanner, Nice Guidance, etc. So we'll go through these in turn. Here they are in all their glory. This is Pubmed for Handheld. Testing Treatments Interactive, also available as a PDF download free. Cochrane Primary Healthcare Fields, Pearls. LazyScholar, Evidence Updates, Camscanner, Nice Guidance, Twitter, Quick Medicine, and Students for Best Evidence. Let's look at Pubmed for Handheld. This is mobile searching with Pubmed on your phone. Download it from here for your Apple iPhone or for your iPad. Download it here for any Android phone or tablet. When you open it, this is what your first screen shows. It has a range of elements, constituent parts, consensus abstracts, clinical queries, various archives, but this is the bit I want to focus on. This is where you can do the PubMed searching on your mobile device. So when you click on this, first of all, this is what you get. You get a Pico structured template into which you put your key elements for searching for information. So I've already done this and put in heart failure as the P. I've put in exercise as the intervention, no comparison, and I was looking at admission to hospital because of heart failure or death, so forth. Now what's not specified here is the publication type. You can click on this and a drop-down menu appears which gives you the potential for not specifying or saying randomized controlled trial, systematic review, meta-analysis, etc. And when you click on whichever one of these and do this, you'll get results. And from these, I found a paper which actually was published in 2010, but then the program reminded me very rapidly that there was a more recent edition or version of this in 2014, which it then produced for me. Now on the screen, you'll see you can click here to mail this to yourself or a colleague, or you can click here to save it to your device for further reading. You can also click here to get the PDF of it. So if you click on the PDF, first of all, you'll get this selection, and then click on the full PDF, and you'll get the original PDF of the 2014 paper. You can then email that or save it. Quick Medicine is a textbook of general practice, effectively, formerly known as GP Notebook in the UK, and here in Malaysia it costs less than 5 ringgit. It's comprehensive, it's cheap, and you download it first of all on Wi-Fi, and then periodically it updates every few months on Wi-Fi. But once it's updated, downloaded and updated, then you don't need to use any Wi-Fi or 4G. It simply resides on your phone and tablet for ease of use. And this is what it looks like. You get some initial screens welcoming you and explaining who they are. Then it asks or checks if your database is up to date, and if it isn't, it updates it for you. You can then scroll through the various sources of information. In this case, I picked cardiovascular medicine, and then check within that for heart failure, and you get a range of things. You get a summary series of screens on heart failure. You can go through congestive heart failure, chronic heart failure, role of ACE inhibitors in heart failure, and so on. Cochrane Pearls isn't an app, but it's a website, and it's been around since 2007 with full archiving of all the material back to then. Pearl stands for Practical Evidence about Real-Life Situations, and it's available through the Cochrane Primary Care Field here, and you can actually subscribe here to their mail list. It gives pre-appraised summaries of best evidence in a range of common conditions in family medicine. So you can search within the search box, or you can scroll down and go through screen after screen. let's look down further here. There was one pearl done on the optimal duration of treatment for eradication for Helicobacter pylori. And this is what it showed. So it's very quick to read this, and it gives a recommendation of 7 to 14 days. Another online website or web resource is Evidence Updates. This is a joint venture by McMaster University Canada and the BMJ Group. Excuse me. On this one, you have to register, which is free. You then choose an area of interest. So, for example, family medicine. It may also be referred to as primary care or general practice. You then need to set a filter for newsworthiness. In other words, on a scale of 0 to 7, how important is this piece of work? And if it's set too low, you will be bombarded with emails and life won't be worth living. I set mine at 6. You will then receive a weekly digest, an email with 4, 5, 6 summaries of pre-appraised evidence for you to look at and decide which one is which ones are of interest to you. Here's an example of a recent email I received from Evidence Updates with 4 papers here, and I looked at the last one. The second one also would be of interest. It's the use of one of the novel oral anticoagulants versus warfarin in patients with previous CVA. And this one here was looking at the safety of lithium in terms of cancer risk in patients with bipolar disorder. You will also get intermittent other emails from Evidence Updates, giving you a sort of a hit parade of what people are most frequently reviewing and reading now. So if you click on this one, you'll get taken to the summary page. It's very brief: background, aims, method, results, and conclusions, and very easy to read quickly. You'll also get comments from other readers, be they from primary care or internal medicine or psychiatry, and that would be useful also to digest. Students for Best Evidence are a group of international medical students interested in evidence-based healthcare. This is their website, and this is their Twitter handle here. And they have on their website very comprehensive topics on structuring clinical questions, PICO structure, study design, research methodology, and then looking for evidence, appraising evidence, acting on it, applying it, and then evaluating your practice as a result. Testing Treatments started off as a physical book and has since developed into an interactive online web page. And this is it here. It has a very good quiz looking at fairness of treatments. You can take this quiz and you'll get your feedback very promptly. The book itself is available for downloading. It's also, you can be bought on Amazon and other sources. And within this whole Testing Treatments interactive, there are several short videos on critical appraisal of systematic reviews, randomized controlled trials, of cohort studies, etc. Nice Guidance is available as an app and as a web link, and you can either search through it for a particular clinical guideline or go through the range of clinical guidelines till you find the one you want. This is free, and like Quick Medicine, doesn't require any Wi-Fi except just for the downloading and updating. Other than that, it stays resident on your phone or tablet, and you don't need to use your Wi-Fi or use up your 3 or 4G data. Twitter is very useful. There's a range of Twitter addresses. Twitter is good at disseminating data, and I'll show you a screen on that in a moment. This is our Family Medicine Department Twitter address. There's some other ones that we use: the Local Hospice Militia in Shiraz, Cochrane Collaboration UK, JAMA, Evidence Updates, Students for Best Evidence, and the overall Cochrane Collaboration. I also like to follow this guy, Atul Gawande, a surgeon in New York and a contributor to the New Yorker and a prolific author. Here's some examples of tweets recently. One here that I retweeted. It was from Students for Best Evidence, written by a physio student, Ed Walsh. It was about an explanation of allocation concealment in the setting of randomization for randomized controlled trials. Very well written, very clear. This also, with Twitter, you get access to alerts about new stories. For example, a publication from the Journal of Pediatrics and Adolescent Medicine in the US showed this cohort study that there was a potential risk for behavior problems in childhood from the mothers of those children having used paracetamol during pregnancy. The BMJ runs these clinical reviews every so often. They did one recently of frozen shoulder, but guess what, la? We don't know what the best treatment is. And finally, there was another paper also in the BMJ looking at hypertension and complications in patients who had both type 2 diabetes but no other prior cardiovascular disease. This is from a national cohort study from Sweden to see what is the outcome in those patients. The big value of Twitter is in its dissemination. It spreads stuff out far wider than the original author of the paper would do. The percentage of people in the world who are science graduates or medical graduates or involved in evidence-based medicine is very low. And without Twitter, their research, especially the really good research, would not be disseminated anything like as widely. Twitter's real role is as a disseminator. LazyScholar is a very useful thing, especially for you when doing your undergraduate assignments in evidence-based medicine to get hold of full-text papers. It's a variant of Google Scholar, and you get it through opening up the Chrome web store, and then you search for LazyScholar and you add it to Chrome as an extension. It stays resident on your bar here. There it is, LazyScholar. This one next door to it is Google Scholar. And when you search for a paper, it will, if it can find the full text, it will. It usually gets it right in about 7 out of 10 cases, and it'll flash up saying full text available. You can then download the PDF of that paper. Finally, Camscanner. Camscanner is a free app available not just for Apple and Android, but also for Windows phones as well. You can download it to any of these sources through this single link. We'll show a demo of this during class. It's better demonstrated rather than gone through here in a video. Okay, thank you.